Thank you.
Thank you very much, Honorable Minister Steele. I now move over to our Chief Medical Officer Acting, Dr. Sean Charles.
Good morning. Let me first say a happy and healthy New Year 2022 to everyone out there, and I hope that everyone is able to enjoy some measure of comfort, some measure of success in whatever the endeavors are in this new year. And yes, we are starting 2022 with the news of yet another wave of COVID-19. We are experiencing cases that are on the increase, but I think we are better positioned to handle this situation that we are faced with right now. So as of yesterday, we have 624 active cases of COVID-19, and I must say that just yesterday 193 cases were recorded. 91% of these cases were detected in the last 8 days. So we have seen a significant rise in the number of cases. However, we have not seen much of an impact yet on our health systems. We do not have persons hospitalized, but we do have a large number of persons that are seeking testing. So right now the challenge is on satisfying the needs for testing for this increasing number of individuals, and I'm going to mention some of the adjustments that we've made for that. So we have not had deaths for some time, including yesterday. Now our vaccination continues to be, it's below what we where we anticipated we would be at this time. We only have about 31% of the population that is fully vaccinated. So we still have some ways to go in that as it relates to vaccination. Now, the country was recently made as it relates to vaccination. The country was recently aware that the Omicron variant, this discovery was made here locally. The testing was done locally. And this in itself, as I've mentioned before, is a tremendous achievement, because Grenada is one of the few places in this region, all right, and probably around the globe, because there are not many places around the globe where you can do whole genome sequencing. So we now have the capacity to do this here locally. This is how we were able to identify the Omicron variant of COVID-19 here in Grenada. It is a partnership between Ministry of Health, SGU WINDREF, and of course in collaboration with CAFA and the University of the West Indies. So we now, what this means, we now do not need to ship our samples overseas to tell what variant of the virus is, and this is a tremendous achievement. Persons may not fully understand it, but this is a tremendous scientific achievement for us here in Grenada. So we were able to identify this new variant circulating here. What is understood about this variant is that from what is seen so far, it is very it spreads very easily from person to person. Now, initially, the incubation period for the COVID virus used to be around, average around maybe 5-6 days, all right? Original strain. Of course, the full duration is between 2 to 14 days. Then with Delta, that incubation period had shortened a bit. So on average was around 4 days. With Omicron, it's appearing between 2 to 4 days. So on average around 3 days. So the disease, it spreads easily from person to person. And persons become sick faster. All right, so the time between being exposed and getting infected and maybe showing symptoms, if any, is shorter. So it's in around 3 days or so. So that is one thing that we should bear in mind. This variant is able to infect anyone. So it is able to infect the unvaccinated, and it has been shown to cause what we call breakthrough infection in persons who are vaccinated. Now, the cause, or what an explanation for this, it could be as a result of waning immunity, but it could be as a result of the virus acquiring certain traits, certain characteristics that makes it get around the immune protection. These things are being studied, all right? These things are being studied. What has been observed so far is that the clinical course has been milder than the previous variants, all right? But I always caution, what manifests in one country may not be the same that manifests in your country, because many of the countries affected have high rates of vaccination. They have high rates of previous infection from successive waves. Grenada is on the second wave, all right, with low level of vaccination, all right? So while we are encouraged by what we have seen so far, we still would like to err on the side of caution, all right? And we want to encourage persons to do the same. So I mentioned that now there is increased demand for testing, and yes, the Ministry of Health offers testing to the public. We do PCR tests and antigen tests. Where are these available? These are available at all of our health centers, the majority of our medical stations, and our hospitals. Now, we do testing as part of our public health duty to identify potential cases and to provide persons with the information so that they quarantine and they isolate, so that they can protect persons in the community. And we also offer testing for persons wanting to travel and all of that, because testing is now a standard requirement for persons traveling anywhere. So for persons who are exposed to COVID and they wish to know their status, they can go to any of our facilities, and the test is offered free of cost. There is no charge, there is no cost for simply turning up at your medical station to have a test to know your status. You may also be contacted by a healthcare provider because you are identified as a contact of someone who tested positive, and you'll be invited to come in and get tested. Right, and that testing is offered to everyone in the population at no cost. We also offer testing for persons who wish to travel. That attracts a cost because testing is expensive. All right, that attracts a cost. The PCR test, the cost is 135 EC. All right, 135 EC dollars. And the antigen test is 50 EC dollars. These can be accessed throughout Grenada, Carriacou, and Petit Martinique at your health facilities. So persons who are wondering where they can go get a test, contact your nearest health center. All right, these tests are available. Of course, you do not pay for the test at the health center. You would have to either pay at your revenue office or online. All right, that is for the persons who are testing for travel. So we want persons to know these two critical bits of information, because we know there's a lot of questions with regards to testing. Now, when do you test? So I was exposed to someone yesterday or the day before. When should I go get a test? Persons are advised to go out and get tested between 5 to 7 days after they were exposed to a case. All right? However, if you develop symptoms, you should go get tested immediately. All right? Or as soon as possible. Okay? So if you arrived in work this morning and you spent 2-3 hours and you just learned that the person sitting next to you was diagnosed, they tested positive, you don't run to get tested immediately, because if the exposure just happened, it is pointless for you to be tested immediately. All right, it takes some time for the infection to develop. So I hope that clears up that aspect with regards to when you test, on where you can get a test, and why would you want to be tested? One, because it gives you information that you can use to protect yourself and to protect others. All right, because when you know your status, you know how to behave. All right, if you're negative, you know that you need to continue following the protocols to remain that way. If you are positive, you know that you need to isolate so that you don't pass the infection on to your family, your colleagues, all right, because they may not be as strong as you are. All right, while you may be able to shrug an infection off without problems, all right, someone with a weaker immune system may go on to have a more severe disease, and it can be serious for these persons. So we did mention that we made, and this is final because I believe I'm going on for a little, updates. All right, updates with regards to our COVID-19 guidelines. Now, firstly, all individuals, all right, whether you've been vaccinated or not, you're expected to follow the protocols. You're expected to observe them always. So you're expected to wear a mask, all right, and wear a mask correctly when you're in the company of people that you don't share the same household with. You're expected to maintain the adequate physical distance as far as practical, as is practical. You're expected to avoid unnecessary crowded scenarios. All right, so if you do not need to be somewhere where everyone is crowding, you don't go there. Avoid close contact with persons, especially if they are displaying symptoms. And wash and sanitize your hands, frequently, so that you avoid contaminating yourself. And I mentioned before, following contact with a positive case, your advice, go get tested between 5 to 7 days. The duration of quarantine, previously we had quarantined persons for up to 14 days. Now we are quarantining you for up to 7 days. All right, so the duration of quarantine, 7 days. All right, and quarantine is of course applied following contact with positive case, but we'll discuss a little more about that. And of course, testing should be done immediately if symptoms develop. Now, for fully vaccinated persons, these persons will not be required to quarantine following contact, except if they reside in the same household with a positive case. Because a lot of the times when you're in the household, I don't think there are many persons who are wearing masks in their house around their family members. All right. So for fully vaccinated persons, they're not required to quarantine, except they are living in that setting. And of course, they should get tested 5 to 7 days. Now remember, everyone is expected to be wearing their mask and following the protocols as I mentioned before. For fully vaccinated persons who test positive, the full duration of quarantine, of isolation, is 10 days. All right? So isolation, all right, when someone tests positive, 10 days. However, isolation can end earlier, 5 to 7 days, with a negative antigen test. All right, so if the person is in isolation, we know that persons who are vaccinated, they have some level of immunity to infection, so they should clear the infection faster. So they can have a follow-up antigen test and be cleared between 5 to 7 days. So your isolation can end early. For unvaccinated persons and persons who are partially vaccinated, the quarantine is the same, up to 7 days following contact. All right? So the quarantine is 7 days. If they are a close contact with a positive case while not wearing a mask, so these persons would quarantine. Now, if you have just a casual contact with someone, all right, and you are wearing your mask correctly, there is no need to quarantine. It's just like, for example, our healthcare workers go to work every day. They treat patients with and without COVID, and they continue to operate as normal because they are wearing their protection in a correct manner. All right, because if you do so, you prevent yourself from becoming infected. All right, so the unvaccinated, they will quarantine if they are a close contact while not wearing a mask, or not wearing it correctly. All right, or if they're a household contact. All right, so we encourage everyone to, wear your mask and so on. All right, it eliminates the need for you to quarantine after an exposure. Okay, and of course, they should be tested on day 7, and if tested negative, all right, they will test it on day 7, and if they test negative, they can end their quarantine. They can end that period early. That is for those who are quarantined. Okay. Of course, they should continue to self-monitor for the 7 days. Now, if an unvaccinated person tests positive, the duration of quarantine of isolation is 14 days. All right, the duration of isolation is 14 days. And the isolation then can end between days 7 to 10 with a negative antigen test. Now, of course, who is a close contact? It's a person who has been within 6 feet of somebody who has tested positive for more than 15 minutes without wearing a mask, for example. Now, finally, this question with regards to travel and testing positive. All right, this question has been coming up often. Who will be allowed to travel into Grenada, following after testing positive? Now, a person who has recently had COVID-19 may be allowed to travel to Grenada with evidence of recovery. They need to walk with some documents that shows evidence that they have recovered. So you recently had COVID, maybe travel out, you recently had COVID, you've completed, you recovered. You can travel into Grenada, but you must produce evidence that you have recovered. And this evidence include, you must present the positive test, all right, on a sample taken no more than 90 days before arriving in Grenada. So it's not like you tested positive in June last year and you can just come into Grenada without any, no. It cannot be more than 90 days. Because beyond that, you get a positive test. we'll consider there's the potential that you might have been reinfected with another variant. So it shouldn't be more than 90 days. And so in addition to the original positive test, that should be no more than 90 days, you must carry a letter from your healthcare provider or from a public health official stating that you are cleared to travel. All right, so that's 2. And 3, you must have a negative antigen test within 1 day. So you need to work with these 3 items. You recently had COVID, you're traveling in, all right, you must work with the original positive test, a letter from your healthcare provider stating that you are cleared, and a negative antigen test taken within a day. All other persons, the regular protocols apply, right? You must have your PCR within 72 hours of coming in. So that's in a nutshell. This will be shared, the document with the updates will be shared so that the public is aware. Thanks.
Thank you very much, Dr. Sean. Before we go over to members of the media, Minister Steele, do you have anything you would like to add to what Dr. Sean has just said?
No, I think our CMO has been clear and concise, and let's go to the media and get some questions from them. That those protocols that the CMO has just spoken to apply to schools, businesses, establishments for entertainment, offices, across the board, wherever people are gathered.
Thank you very much. We now move over to members of the media, and first up this morning to pose his question, we have Mikey. Mikey, go ahead.
Minister Steele, good morning to you, and Dr. Charles, good morning and Happy New Year to you. So regarding testing, I get a lot of people calling to say that when they go to get tested, they're asked whether or not they have symptoms, and if they don't have symptoms, the nurses or whoever is there do not want to test them. Is that the clear policy on what should take place with people who go to get tested for COVID-19? Should they be exhibiting symptoms?
No, Mikey, let me categorically say that is not the policy of the Ministry of Health. Persons can go tested under the conditions that the CMO has just specified. And for instance, somebody who needs to test for travel is not going there because they're exhibiting symptoms. I cannot speak to what some individuals may be saying, but I can say by and large, in almost all of our health centers, we have been testing, taking persons in, and they've been getting tested and coming back to work or going into isolation with the results depending on what the results say. So no, it is not a policy to turn persons away if they are asymptomatic, because we've clearly stated here that this disease and this variant in particular can infect, and someone who is asymptomatic can be infectious or contagious.
Dr. Sean?
Yeah, and let me just say that why this is not the policy, you will never detect a person who is asymptomatic. You would never detect an asymptomatic case if you adopt such a policy. So no, that is not in accord with our policy.
Mikey, do you have another question?
Yes, I do. As it relates to booster shots, do we have a clear policy on that in terms of who is eligible to receive a booster shot? And at what stage?
Yeah, Mikey, we want all persons are eligible now for boosters, as has been prescribed by PAHO, by WHO, and by CDC. And we are, Dr. Charles can say, but we were starting at 6 months, but anytime between 3 and 6 months of having your last vaccine, you can come forward for a booster now.
And let me just say that we have individuals that are priority for boosters. And these are the individuals who are our frontline workers who are, exposed. also persons with underlying health issues that place them at risk for severe disease. So these persons are given priority. All right, that we especially encourage them to come and get their third shot.
Just to add as well, we have more vaccines, more variety of vaccines on island, quantity and variety than we've ever had before. So please, anyone who wants to get vaccinated or get a booster, it is definitely available.
Thank you very much, Mike. We now move over to GBN. Colleagues at GBN, are you ready with your questions?
Good morning, Joseph, GBN. A question for Dr. Charles. Dr. Charles, you have highlighted a number of protocols for the different tests. However, the minister would have highlighted challenges to the testing procedures. I really did not hear in terms of a different methodology, in terms of addressing the challenges that the ministry is now seeing when people coming in for testing.
Well, what I alluded to was the fact that yes, there is increased demand for testing, and yes, the Ministry of Health is presently examining strategies to address this by, one, getting additional persons, all right, getting additional persons to make testing available, additional persons to actually do testing. And one, we need to once again, because as you would recall, part of our success in handling the previous wave was that we were able to attract a large number of volunteers to assist us in going out there and doing testing, especially on weekends in communities. So we are currently engaged in bringing that structure back together and getting those activities going.
Gerard, do you have another question?
None for now.
Okay, so we move on now to Ms. Nancy Maguire.
Good morning, everybody. Can you advise whether the situation that we have now is a community spread? You said it's our second wave. Is it actually a community spread? And can we get a breakdown in the age categories of the 600 plus active cases that we have now? And following up on the question about booster policy, can you give us a status on the vaccines that we have available? And some of us that are ready for their boosters are not sure which one to take. So, Dr. Charles, can you speak on that? Thank you.
All right, so in answer to your first question, yes, we have community spread. I think when we announced the variants, we did state that they have no travel history, meaning that they did not leave the country. So the disease met them here in Grenada, and we cannot trace or link or state who infected them. So that is answer to the first question. With regards to the 600 plus cases, I do not have an age breakdown of them. When data is reported to us initially, we get that data in aggregate. All right, number of tests positive. Later on, the details of each case is filled into a database, and we may be able to provide that information. With regard to the question about the status of the vaccines, I think right just before the holiday season, we received just under 70,000 doses of Pfizer vaccine. It was 69,030 to be precise. And if you have been observant, you would note that the number of persons receiving vaccines have been going up pretty slowly. So we do have, we do have a large quantity of vaccines on our hands, and of course we are still encouraging persons to come out and get vaccinated. We have also a number of doses of AstraZeneca vaccine, a number of doses of Johnson & Johnson vaccines as well that are available. With regard to the booster, which one you should take? I mean, that is a kind of a question to answer in Grenada, because it shows you that we are kind of blessed in a certain way. Sometimes you ask that question without thinking about what you're asking. We are blessed in that while many developing countries cannot get their hands on vaccines, we are discussing, which choice should I use, which in itself is quite an achievement. Well, what I can tell you is, we give you a choice, and I'm happy to say that we give you a choice. All right, we give you a choice. If you have a preference for one or the other, we honor that preference. All right. Of course, research has shown that when you boost with an mRNA following a viral vector, there are some advantages that are seen. All right, there's a significant boost. So you can get boosted with Pfizer. All right, if you've been vaccinated with AstraZeneca, you could also choose to take your boost with AstraZeneca. All right, so I'm happy that at least we have choice here in Grenada.
Ms. Maguire, do you have another question? If not, we move on to Nisha Paul.
Yes, I have one more. It seems that when we had the community spread before and everybody kind of panicked, that's when we had a lot of volunteers showing, and along with the pop-up clinics. Are you going to bring back those pop-up clinics and reach out to more Grenadians to get vaccinated or boosted? Thank you.
Yes, Nancy. In short, yes. Those pop-up clinics should start from tomorrow across the country. They only stopped over the Christmas and New Year's weekends, because those were two long weekends. And some of our volunteers had either traveled or took a break to spend time and give thanks with friends and family. So yes, the weekend pop-ups start back, but during the week as well, we're looking to start some pop-up clinics as soon as tomorrow in certain areas, as well as the Ministry of Health itself bolstering our team within our health centers for testing.
Thank you. I've indicated for Nisha Paul. Is Nisha Paul there?
Yes, I am. Good morning.
Okay, go ahead.
And a happy new year to everyone as well. My first question, although the increase in the COVID-19 cases has had no impact on the health system as yet, according to Dr. Charles, you said we're in a better position to handle the COVID-19 situation. Can you explain exactly what you mean by that, in light of the fact that, in the past, when we have had the surge in the past, there has been a strain on the health system altogether? And my second question is, have we had any vaccine breakthrough infections locally? And what are the measures, if any, in place to monitor the same? Thank you.
If I can just before Dr. Charles comes in, just to say that the most recent wave has had an effect. Because remember, like previous waves, or the previous wave, our health team are also members of the very communities that are getting infected with community spread. So we do have individuals in isolation because they are positive that may be members of our health team. But as the CMO and Dr. Charles rightfully said, we're not seeing hospitalizations. And that point is it is not affecting our health system from there, but I'd leave him to answer the rest.
Yes, when I say we're in a better position, I mean there are several factors to consider. in the past, I mean, although our vaccination coverage is still quite low, it's somewhere. All right. So we must take into consideration that yes, we have just over 30% of your population that is fully vaccinated. We have a significant number of persons who were previously infected with the Delta variant. All right, very recently. So we have, when you take immunity due to vaccination and previous infection, it adds up. All right, it adds up. In addition, we have more experience with handling surges of cases and with handling waves of cases. All right, and all of these put us in a better position to handle this new wave. We are not as anxious as we were when we were, basically naive. And these are what place us in a better position. With regards to breakthrough infections, well, what I can tell you, what has been observed is that these individuals sometimes have no symptoms or very mild symptoms. All right, so persons who get breakthrough infections, they generally don't get sick. Now, I do not have, like I say, we receive the data in aggregate form, meaning, when I say aggregate, meaning number of cases, number of tests. So I do not have data on vaccination status of persons who are infected. But certainly, from the numbers that are being recorded, all right, I'm almost certain that there are vaccinated and unvaccinated individuals and individuals who were previously infected included among the 600 plus.
Thank you. We move now to Linda Straker. Ms. Straker.
Good morning. Yes, good morning to everyone and Happy New Year. My question is put to maybe the minister and or Dr. Sean. We know that Omicron is now going through its own phase around the world. But so far we have only learned that only 7 samples that was confirmed in Grenada. But we are seeing hundreds of persons infected in this wave. Has the ministry conducted sampling to find out whether or not we have dominant Delta, or we still are, or most of the cases are Omicron cases now? Has any research been done into that? My other question is, recently Jamaica would have disclosed that according to the data from adverse reaction to the vaccine, how much the age range of persons who were affected and so forth. Has Grenada done any analyzing of its own data with regard to adverse reaction and of persons determine the age range and which vaccine is given much more reaction than the other? And the third question for now, I do have more. In other parts of the region, we have seen the cruise lines are coming back. Some countries do have a protocol or memorandum of understanding with the cruise lines. What Grenada protocol requires for cruise line to board? So like in one territory, the cruise line should have no less than 1% of its persons on board infected with COVID for them to allow to board. Do we have such a memorandum of understanding with the agents and the cruise line that once you cross a certain percentage, you would not be allowed to board, you automatically have to turn back? Do we have such a thing for the cruise line industry?
Linda, let me take question 1 and 3 for you. On question 1, when we do sequencing, it's a sampling. We're not going to sequence every single positive PCR result. So we did a sample of 11 and found all 11 to be Omicron. That tells us that Omicron is the dominant the dominant variant in circulation at this point in time. Our policy moving forward would be to do some random testing to ensure, but also, if perchance, God forbid, that there were any individuals who developed severe symptoms and were hospitalized, those individuals would be, a sample would be taken for sequencing to see if it is Omicron or if it is Delta. But at this point in time, that would be the policy moving forward. And on question 3, with respect to the cruise line, that's maritime law. That has been there since way before, since tall ships. With respect to the quarantine, reason for quarantine, and what is called pratique, or granting a ship access to or the ability to disembark or have its passengers disembark. So yes, 1% and above of an infectious disease allows us, through the CMO and the environmental health officers that do the inspection, from the declaration that a ship gives, any ship, not just cruise lines but cargo vessels as well, that once there is that level, then pratique is denied, which is individuals are denied the ability to either come into port or to disembark from the ship. And that's a standard. We worked again with the cruise industry and CARFA with respect to additional protocols for testing and the level of testing, frequency of testing for persons coming on board the vessel, as well as for persons disembarking at the vessel at any of the ports. There is variation throughout the CARICOM on the level of testing, and that does bother us significantly, but we hold hard and fast to that 1% as well, and those declarations. I'm not sure if CMO would like to add anything more, and if you can tackle question 2.
Well, let me just say, with regards to question 3, yes, we do have a cruise ship protocol that can be made available to you if you would like to examine it. With regard to the second question, adverse reactions and analyzing the data. Well, firstly, we encourage anyone who has an adverse reaction of any type following vaccination to report it to the Ministry of Health. Now, if you take a look at your vaccination card, that's the same card that you get when you're going to get your shots. There are some instructions there on how you can report, or how you can make a report, right, so that we capture that information, right, and that information is stored electronically in our immunization register. And of course, it can be analyzed to see what what are the patterns of adverse events. To date, we have not had any reports of significant adverse events occurring. We have had individuals who have had some side effects. They've had fever, they've had headaches, muscle and joint pains. All right, these are the reports that we have gathered so far. All right, but like I say, the immunization, the vaccination card, if you look at the back of it, it gives you instructions how to report any event. All right, and we will record it and we will investigate it.
We move now to MTV. MTV?
Hi, good morning. Good morning. I have a question. In the last wave that we had, we saw a lot of the business closing as employees were, 1, not vaccinated, and 2, showing symptoms and getting, testing positive. For this wave, I'm not sure, do you foresee that happening and companies having to close, and even though the employees may be fully vaccinated? I know we spoke about the breakthrough infections as well. Is this something you foresee happening again during this wave?
There is a possibility. I mean, there are many companies that are fully vaccinated And then there are many establishments that are not, and therefore their risk levels will vary. And it's also not just a case of level of vaccination. Remember, this is being spread in our communities, not necessarily in our workplaces. So individuals based on interaction when they're at home as well, which is why I started by thanking the many individuals that were very reserved this weekend, recognizing the threats that existed. So, Drew, it's a bit early. It's a bit early to see. But while I have the floor, I just want to clarify something on the previous question that was asked by Linda. There is a protocol for cruise ships, whether a cruise ship has any positive cases or not. A protocol for how we deal with cruise ships coming in to Grenada. And then the granting of pratique, or so what Linda was referring to with the 1% or so, is a different policy now with respect to any vessel, cruise ship or any other, that may have a positive case of COVID-19 or any other contagious disease. There's a separate protocol there.
So with regards to that question, remember when I mentioned that there was some updating to our protocols, and one of which was fully vaccinated individuals are not required to quarantine after they make contact with a positive case, except if they're a household, if they live in the same household with a positive case, and they're unable to separate. Now remember, all individuals are expected to be following the basic protocols at this point in time. So we do not anticipate that there will be all of the disruptions that we had in the last wave. All individuals without excuse are expected to be following the protocols. So a casual exposure, a casual contact with someone who tests positive should not disrupt a business. All right, and that is where we go back to, persons being personally responsible. All right, it is expected and it is assumed that you are following the guidelines, you are wearing your mask correctly, and you are maintaining appropriate distance, you're sanitizing and all of that. If you are fully vaccinated, there is no requirement for you to quarantine, except if you live in the same household. When you live in the same household, you are able to separate. All right, I hope that clarifies it a little.
Okay, Dr. Sean, I also have this question from the chat. It says, self-testing is happening a lot more than ever now. What should persons do if they test positive when they do it by themselves?
Yes, self-testing is quite common. I know here in Grenada, it may be difficult for us to get our hands on self-testing kits because of the whole global situation, and there is a high dependence on testing now, so that persons have information to make decisions. All right, it's kind of difficult. I'm not sure if there are kits available in the private sector, sorry. But yes, what should someone do if they test positive? Contact your local health center or medical station. Isolate. All right, you must isolate for the required period. Now, you may do a self-test. You contact our clinic. All right, we may repeat that test. We may do a repeat antigen test to verify. Okay? But you need to isolate for the period stated. All right? And you need to inform your contacts. You need to inform your contacts that I have tested positive. All right? I was around you. We were not wearing masks because sometimes that happens. You need to go get tested, and go get tested within the time period that we state. All right, if they were exposed, a day ago, then they have to wait another, 4 days or so, and then go get tested. That would be the advice.
Before we move around the table for the second, a couple of colleagues have some more questions. In your introductory presentation, you mentioned a bit about the 14 days as opposed to the 7 days, and that you'd have elaborated a bit more in terms of the quarantine. Can you do that for us now, please?
Right. So one, we need to separate quarantine from isolation. So quarantine is what happens after you are in contact with someone who tested positive. All right, so you have not tested positive yet. You are just a contact. All right, the duration of quarantine is 7 days. You're tested, you're negative around day 7, quarantine ends. If you are unvaccinated, you have to continue to self-monitor for another 7 days, up to the 14-day period. Okay, so duration of quarantine, 7 days. Now, isolation is for after you test positive. So now you have received a positive test. If you are fully vaccinated, the duration of your isolation is 10 days. If you are not vaccinated, the duration of your isolation is 14 days. Okay? However, this time may be shortened. This time may be shortened in the fully vaccinated to between 5 to 7 days if during that time they do an antigen test and it returns negative. And with regards to the person who is unvaccinated, between 7 to 10 days you do you repeat an antigen test and it is negative, then your isolation can be ended once you get that negative test. So I hope that makes it a little clearer.
Just for a bit of clarity too, you said a repeat test, but I know in the initial stage when you contracted the virus and you go through the 14 days or whatever, you weren't required to test again. So what is the difference here?
That is a very good question. You are not required to take a repeat test. You are not required to take a repeat test. You only do the repeat test to end your isolation early. All right, so it's not a requirement. So you can test positive, you do your 10 days isolation as a fully vaccinated person. You do not need to do a repeat test. Once the 10 days have expired, all right, you are cleared medically. You can return to work, return to your activities, and so on. For an unvaccinated person, same thing. 14 days, you do not need to do a repeat test. Your isolation ends on 14 days, all right, and that's it, all right. The adjustment for early clearance is based on, because persons have work, they have different demands, all right, and the different individuals, based on the strength of their immune system, they are able to clear this infection earlier. So the option is there to do a test and end isolation earlier.
Thank you. We now take a question each from Linda Straker and should be followed by Nancy Maguire.
Good morning and thanks. My question has to do with the dashboard. Now, previously in the first wave, when we got the dashboard, we would have seen like import cases, meaning persons who would have been detected at the airport, compared to persons who, when it was now community spread. We're no longer seeing that. Can Dr. Sean or the minister explain why that division is no longer presented to us? And relating to that, from the numbers that we're seeing, it's I think 600 plus. How much among those are persons who have been tested to leave the island, to go out, whether they came in for the Christmas holidays and were now looking to go back? How much among those are persons looking to depart the island, as to compare those who are within in the island had no intention of to travel or were about to travel?
Linda, remember CMO started by saying when we did the sampling, the 11 individuals that we sampled had no travel history. So these weren't people that came in to then go back or so. These were people that were living here, and they didn't have somebody come and visit them either. These were individuals that were here. When you go to once you declare community spread, you do make a separation. You stop making that defined classification between imported or those in quarantine and those in community. When we go back to where we have very little or zero cases in circulation, we will then say that this positive or these 2 positives or these 5 positives are in quarantine and they're travel related. And you would have heard us say that in and between when those circumstances do exist. Right now, we are in a case of community spread here, so there isn't that significant separation because it still remains there's a constant small on the travel, a 2 or 3 or so max in any given week, travel related. Because persons take that test before travel, many of them will test positive before coming to Grenada and will not be allowed to board the flight.
Let me just say that the thing is, whether we report on cases of COVID in Grenada, all right, whether that case travels into Grenada and was detected here, or is someone in the community that was detected here, we report on cases that exist in Grenada. And the division of imported and local, it's of little significance. And why it's of little significance is because Grenada has community spread of COVID-19. We are unable to identify a clear link for many cases. All right? Because the disease is spreading here, person to person. All right? Now, that division, and I like the word division, that division about imported and local, it tends to convey a false sense of security that it's someone else that is doing it to us. All right? Or it's someone else's problem, or is, or it is the ports, or it is a false, it conveys, the wrong impression, when the fact of the matter is that the disease is here. Since it entered and since we developed community spread, it has not left. We are still detecting Delta. All right, over just about 3 weeks ago was our last detected case of Delta. This test was done at CARFA. So we should not be looking at this and assuming for a moment that this is something that is coming from outside. Grenada is, COVID is now endemic throughout the world. Right? COVID is now endemic throughout the world, including here. We're all human. All right. So these false divisions of them and us, we do not support it because it does not add any value to the information that we have. All right. What matters is what we do to protect one another and ourselves.
Thank you, Dr. Sean. We have reached the 1 hour mark, but we still have a follow-up question from GBN and Nisha, so we'll take those before we wrap. GBN?
Yes.
Go ahead.
So, my final questions. We've seen Air Canada stopping flights, and it is reported to be related to the new wave. Any concerns there? And school is reported to reopen fully from Monday with the large amount of positive cases we've seen from yesterday. Any concerns going into that proceedings?
On the Air Canada, I have heard that news and seen an announcement. It's unfortunate, but remember, those sorts of decisions are made from taking into consideration various factors for Air Canada, volume, etc. Canada has had a different travel policy too in the past, and it's quite likely that you are seeing that they don't have the loads. It's not just for Grenada, but I believe for Antigua and some other Caribbean islands that they've said that they're going to be stopping flights for the time being, and it's based on volume. They are a business. Air Canada is a business. Your other question, I think I'd like Dr. Charles tackle first.
Right, so the question of schools. Let me first say this. The thing is, this pandemic has done and is continuing to do irreparable harm to our children. The consequences of this, I am not sure if the Grenadian society is fully aware of, and is fully we are prepared. If we are prepared to tackle the social isolation that exists right now, as it relates to our school children, the worsening of the inequities that exist right now with regards to families who have the means and family who have not. All of these things are doing severe damage to our children. This is something that we cannot ignore anymore. And it's not just us. There are countries that have worse outbreaks than ours, and schools are prioritized to open. The thing is, this thing is not going to change tomorrow. It may not change this year. It may not change next year. But our children cannot wait. And our society needs to understand that. You know, we need to understand that we cannot suspend and we cannot postpone the education of our children any further. There are many children that are simply, they're falling off the radar. I don't know how we can ignore this. I don't know how anyone can justify this any further. I mean, I would support the full opening of schools. We will address whatever challenges comes up. If there are children or there are schools that are affected, we will go in, we will test, we will quarantine. But we can't keep these children at home forever. It's no longer acceptable. And the thing is, I am surprised that there isn't an outcry for the children. I do not know what has happened to our society, but there isn't an outcry for the children. There are children who probably have received no instruction for going on 2 years because their families have no electricity, they have no phones, they have no. What happened to them? Where do they fit into society? I mean, this is my own personal take on the situation. That if we don't have persons advocating for education of our children, you know what is going to happen? The families that can afford to ensure that their children continue to have an education, and the families that are struggling, we offer no hope for those families and for those children to get out of poverty, because education is one of the most sure ways of getting families out of poverty. So when you look at benefits versus risk, there is nothing more damaging that this pandemic can do, because it is already robbing the future of from these children.